Assalamu alaikum wa rahmatullahi wa barakatuh. So our lecture today is anesthesia for hysterectomy patients. So in this lecture we're going to talk about the introduction, why do I need hysterectomy, what things to consider, شنو الأشياء المهمة اللي ممكن to consider during the hysterectomy, the type of hysterectomy, أنواع hysterectomy, recovery, complication, and Apgar score. And I mentioned Apgar score here to link the hysterectomy with the Apgar score after deliver the baby. So in this lecture is linked to the previous lecture. Like as you know, we already taken the lecture for anesthesia for cesarean section. So cesarean section and hysterectomy is all about the gynecology branch. So let's move on to the intro. So a hysterectomy is a surgical procedure to remove the uterus. So womb, what's called uterus. So uterus هو عبارة عن الرحم. So هي عملية جراحية لإزالة الرحم. You will no longer be able to get pregnant after the operation. So هي عملية لاستئصال الرحم completely out of the body. So if you haven't already gone through the menopause, you will no longer have period, regardless of your age. The menopause is when women monthly period stop. So the menopause is when the woman monthly period stop, which usually occur from age of 45 to 55. Around 30,500 hysterectomy were carried out in England. That's some statistics. هي هناك بعض الإحصائيات حول العالم فيما يخص الهيستريكتومي. And it's more common for women age 40 to 50 to have hysterectomy. هذه just introduction. So why do I need a hysterectomy? ليش نسوي عملية الهيستريكتومي؟ Hysterectomies are carry out a treatment condition that affect the female reproductive system. هي عملية لمعالجة reproductive system، عملية التكاثر الموجودة فيما يخص الفيميل. ليش؟ including heavy period, long term pelvis pain, so pelvic pain, so اكو ألم بالبلفس أو heavy period, so non cancerous tumor, fibroids عبارة عن سير تليف بالرحم, so ovarian cancer, سرطان المبايض, uterine cancer, سرطان الرحم, cervical cancer or the cancer of the fallopian tube. قناة الفالوبيان تيوب هي التيوبات الموجودة في الرحم المرأة. So هي عملية لاستئصال الرحم. There is main reason that you're gonna do the hysterectomy, and you should be aware that everything beside you, because it's one of the major surgery that could be related with the major complications. So hysterectomy is a major operation with longer recovery time, and only considered after alternative less invasive treatment have been tried. So هي تعتبر من العمليات النوعية الكبرى اللي you should be considered a lot of things beside the treatment. So what's the things to consider? There is too many things to consider. If you have a hysterectomy as well as having your womb removed, أقصد الwomb هنا الuterine, you may have to decide whether to have also cervix or ovarian removed. So هي عملية تشيل السيرفكس عنق الرحم أو الovarian tube أو الأوفريز المبايض أيضا. So هذين things to consider during the surgery. So your decision will usually be based on your personal feelings, medical history, and any recommendation your doctor you may have. You should research the different type of hysterectomy and their implication. So there is implication. So هي شنو العملية نوعية لاستئصال الرحم and should be ترافقها استئصال المبايض أو استئصال السيرفكس أو العنق الرحم. لأنه there is complication, could be cancer, could be bleeding, and any sort of things, and you have to be very aware and very careful to do that stuff during the surgery. So عملية نوعية جدا ومهمة وتعتبر من العمليات النوعية الخاصة في عالم الجراحة. Type of hysterectomy. The main type of hysterectomy are شنو هي التايب of hysterectomy؟ عندنا تقريبا 4 أنواع. total hysterectomy واللي هي the womb and the cervix negative removed is the most common performed operation. هي تشيل السيرفكس يعني تشيل عنق الرحم مع الرحم هي the total hysterectomy. Subtotal hysterectomy, the main body of the womb is removed, leaving the cervix in place. بس تشيل ال main body of the womb اللي هو ال uterine. Total hysterectomy with bilateral sublingual oophorectomy, the womb, cervix, fallopian tube, and the ovaries are removed. So total hysterectomy, تشيل all of them, fallopian tube, cervix, rahim, and so on. So radical hysterectomy, the womb and the surrounding tissue are removed from fallopian tube, part of the vaginal ovary, lymph gland, and fatty tissue. هذا فيما يخص total so type of hysterectomy, which is the main type of hysterectomy are four, and already mentioned there what the type of hysterectomy is. There are three ways to carry out a hysterectomy. Three ways. So the vaginal hysterectomy, where the womb removed through cut the top of a vagina. So abdominal hysterectomy, where the womb removed through a cut in the lower, and the abdominal laparoscopic hysterectomy. So laparoscopic hysterectomy, the keyhole surgery, which is the womb removed through cervical small cut in the abdomen. So there are three ways to carry out the hysterectomy: vaginal hysterectomy, abdominal hysterectomy, and abdomen laparoscopic hysterectomy. So complication of hysterectomy. شنو الكومبليكيشن تصير بالhysterectomy? We already mentioned there is too many complications that could be happen. There is more risk of a complication, so include the heavy bleeding, infection, damage to your bladder or bowel, serious reaction to the general anesthetic. There is serious reaction, could be serious reaction to the general anesthetic. How this performed? There are three ways to hysterectomy can be performed. Already mentioned vaginal hysterectomy, abdominal hysterectomy, or laparoscopic hysterectomy. That the performed of the complication of the hysterectomy. Recovery. So الريكفري مهم جدا عندنا لأن could be a patient in pain, could be need some analgesia. So after having a hysterectomy, you may wake up feeling tired and some pain. The normal after type of the surgery. You will give him painkiller to reduce any pain and discomfort. تحتاج painkiller here, and the nurse or anesthetist will give you some medication to relieve this pain. هذا فيما يخص complication in general. There is specific complication in general anesthetic, complication in general anesthetic, bleeding, ureter damage بالحليل, bladder or bowel damage damage بالمثانة أو تلف بالمثانة أو البول أو الأمعاء, infection, thrombosis, so vaginal problem, ovary failure, early menopause. So here هي عبارة عن complication that will be related to the hysterectomy. Apgar score هذا فيما يخص البيبي, and I already mentioned it here to give you just like brief information, and I'll list in the website, or I listed in the link what the Apgar score is and how to measure the Apgar score related to the baby. Apgar score is a system used by doctors and midwives to assess. هذا تعريف الأبجار score. The system is a system used by doctor and midwives. So يقصد النurse to assist your newborn baby health at birth. It helps medical staff decide if your baby needs medical or emergency care. So what does the Apgar score measure? The Apgar score checks 5 characters of your body. There are skin color, heart rate, reflexes and responses, muscle tone, and breathing. What does the Apgar score measure? Skin color, heart rate, reflexes and response, muscle tone, breathing. What does the Apgar score mean? Apgar score is a score of 7 or more is normal. A score of 7 or more is normal. A score of 6 or less at 1 minute and a score of 7 or less more than 1 minute is also normal. However, score below 7 in the second test at 5 minutes is considered below. If your baby score was low in the first Apgar score test and hasn't improved in the second 5 minutes, there is other concern. The doctor and nurses will closely monitor your baby and monitor necessary medical care. So هو عبارة عن score to assess the baby activity or baby performance. So it should be 7 and above, 7 or below, you should be considered medical treatment or medical consultation to assist your baby. Of our lecture today. Please guys, don't hesitate to ask me a question as usual. Post, comment, any suggestion, I would be happy to answer you properly. Thank you very much for your listening. I look forward